In this podcast, I will discuss the condition Ostechondritis Dissecans, which is a pathology of the elbow joint. This condition develops gradually over time due to repetitive valgus force that compresses the head of the radius and the capitellum, which, as you can see in the picture, is located at the distal and lateral end of the humeral shaft. Due to this compression, there is disrupted blood flow to the joint area, and this causes the osteochondral defect to develop over time. Along with this condition, it is quite possible that a fragment of the bone will come loose or even come off and float around within the joint capsule, which can cause problems with the articulation of the joint. Young athletes who participate in overhead throwing and serving sports, such as baseball and tennis, are the most common to suffer this condition. Other athletes that may experience this condition are gymnasts, due to the fact that some of their positions require them to bear their body weight on their hands and their arms. The compressive and tensile forces during a throwing motion or other repetitive motions cause the compression between the radial head and the capitellum, creating the conditions necessary to develop this pathology over time. As you can see in the picture, which is posterior view, the compressive forces are on the lateral side. An athlete who has this condition may come in and complain about lateral elbow pain, locking of their elbow, the inability to extend their elbow all the way up to 180 degrees, and even maybe as little as only extending it to 90 degrees. Also, there may be that dislodged piece of bone within the joint space. The diagnosis for this, the only true way to diagnose it, would be through an MRI or an ultrasound image that will show the disformity within the capitellum. While trying to determine whether you're going to send an athlete in for one of these diagnoses, you can rule out other pathologies of the elbow, such as radial nerve entrapment, epiphyseal fracture, and a posterior lateral rotatory instability. Again, some of these are similar, so the MRI and ultrasound will be the best way to find it. Different special tests that can be used to lead you down a path that might have you send an athlete in for an MRI and an ultrasound are the valgus stress test. A positive sign would be pain with lateral compression during the test. Also, the use of the chair test, which includes an athlete trying to lift themselves up out of a chair using just their arms, and they would have reproduction of their symptoms. Also, the push-up sign would be they'd be unable to perform this test because of, or maybe unable to get into the position because they wouldn't be able to extend their elbow. Again, these tests are similar to some tests for lateral instability and other pathologies with the elbow. To treat this injury or condition, there are a couple of different protocols depending on whether the fragment has separated or not. If the fragment has not separated, you can rest the athlete and have them start on some progressive range of motion and strengthening exercises to help reduce that compression from the valgus forces on the area. However, if there is a loose fragment in the joint, surgical intervention is needed to remove the fragment and also to clean up the cartilage and the damage in there. To return to play, in either case, especially in throwing athletes, the return to play would be guarded, which means you would watch them and ensure that they are not creating that stress on their elbow again.